The fact that we're seeing, 175 to 200 is a real stretch for us.
Winnipeg's Children's Hospital continues to see nearly 200 patients a day when a normal respiratory virus season would see around 135.
The reason for the high traffic in children's emergency has to do with the high viral burden in the community. Although we are still seeing some COVID, the main players right now seem to be RSV and influenza A.
Dr. Elizabeth Doyle, Section Head of Pediatric Medicine at the Children's Hospital, says normally 60% of children who attend the emergency department are less acute patients, while 40% need urgent care. She says now that number is flipped.
Many children are testing positive for more than one of these viruses, and roughly half of all of the patients arriving in children's ED over the past couple of weeks are experiencing influenza-like symptoms.
Manitoba follows Australia's flu season closely as a measure of what it'll be like here. Dr. Doyle is preparing for a higher influx of patients.
They started their flu season earlier than normal. They hit a higher peak than normal, and the influenza lasted longer than normal. So they had a particularly bad flu season. We are anticipating something similar here.
Dr. Doyle says there are 8 patients in the pediatric ICU and 50 patients in the neonatal ICU. 182 patients visited the Children's Emergency Department on Monday. 34 patients were hospitalized with RSV in November, 22 of those in the last week.
We're definitely feeling the crunch, perhaps not to the same intensity as they are feeling it right now in the pediatric hospitals, but we're definitely starting to feel it.
Dr. Philip Legacy-Waynes is a medical microbiologist at St. Boniface Hospital, and he says they have emergency rooms that are full, but there are steps the community can take to lower the burden on all hospitals. He and Dr. Doyle say it's important to get vaccinated against the flu, wash your hands, clean high-touch surface areas, and cough into your elbow, adding that Manitobans should keep kids home from daycare or school if they're sick to help ease the viral burden in the community. Both doctors are also recommending wearing masks in public settings.
Do what we did for our elderly parents and grandparents for the kids that are suffering right now. We did it for them. We should be able to do it for the kids of the community too.
Dr. Doyle says this season will be challenging, but is confident in the Children's Hospital's ability to find solutions. In Winnipeg, Mike Albanese, City News.